Namaste, everybody. First of all, at the outset, would like to thank the organizers of Ophthall 2020 for giving me a second opportunity to interact with you. I'm very glad to be here. And this time it's a different experience talking to you through the digital platform, courtesy COVID-19. And what I'm going to talk about is something which is very dear to my heart. It's about patient experience and why is it so critical today more than ever. Let's take you back to the 1980s. There's a doctor in a dilapidated clinic with a single fan and wooden benches, and we have patients waiting for him with no complaints. They only want to get cured. That was healthcare 40 years ago. Come 2020, and the patient is the center of attention, asking you for the smallest of frills as their biggest expectations and will not compromise. Today is the age of experience, and what kind of experience you give to the patients will determine whether it will be your practice made or your practice broken. So the tables have turned from the doctor will see you now to today, the patient will see you now. Before I go to my mantras that I would like to share with you, I thought let's come up with some interesting and some disturbing takeaways from a research which was conducted by an American magazine. And as you can see, one thing which is very striking is that the patients who are unhappy, many of them will not raise their voices. Only a few will come to you to tell you that your service was bad. It's also very difficult to get new patients. It's very tedious, it's very cost intensive. The best is to make your patients as brand ambassadors and retain them. And over a long period of time, the lifetime value of that patient will be something that you would be looking forward to. Negative publicity always spreads like wildfire. So I know of many communities on the Facebook pages of hospitals where they just post negative reviews about the hospital, and you would sometimes have 5 or 6 reviews coming every day. And if you have loyal patients for you, they will not just come back to you, but they will also speak highly about you as your brand ambassadors and increase your footfalls without having to spend on marketing. So what has happened is that today we have moved away from being a service economy in healthcare to being an experience economy. So the patients are not just looking for cure, they're looking for cure and care and compassion and convenience. So here we come to the pillars of patient experience. So the secret sauce of patient experience has 6 ingredients, and we'll be talking about them and how the magic recipe can lead to a delightful patient experience, which is about convenience and customization, quality, support, communication, and transparency. So let's start with something which is the most important in the beginning for even to get patient to your doorstep is the convenience. Now we start with appointments wherein patients want to take an appointment either through a call center, they should want to take it online through your website, they are accessing chatbots. So you should be open to appointments through all mediums. Now, the biggest dissatisfier in an eye hospital today is the waiting time. And all of us need to work on our processes and come up with innovations that we can reduce that waiting time, the process time, because the people sometimes are taking leaves and short offs from their workplaces and they want to get back. So nobody wants to spend too much time. When we come to carrying records, and sometimes you have records of various hospitals, if you have multiple illnesses, nobody wants to carry physical records. People want it at a click of a button, and I think that is something that we need to respect and deliver. Now, when we come, patients who are not paying out of pocket, they are waiting for TPA approvals and reimbursements, or patients are denied because of lack of empanelment, and all this is going to just drive away business away from you. So, from credit patients, we need to look at their convenience so that they can vouch for you and come back again and again. Especially in COVID times, home eye care and telehealth has grown by leaps and bounds. People are scared to come to hospitals, and they are willing to, especially the old patients, old aged patients are willing to get their follow-up consults done through home health or through telemedicine. We should have the technology platforms in our hospitals to be able to give them this facility. Accessibility to the care provider, that is you as practicing doctors, is extremely important. Patients sometimes would want to access you on WhatsApp. Patients want you to be available in the OPD when the appointment is there. You can't give them excuses that you're in the OT or you got late. You need to be there for the patient when they need you. Parking in metros and big cities is always a problem. And I've seen so many patients who will not even enter your building when they see that there is no parking available. They'll go to a nearby doctor where there would be the ease of parking. So please, even if it means organizing valet parking, do something about that. When we talk about digitization, we're looking at paperless registration forms and digital queue management, even online patient feedback. Nobody is filling forms. People want to get pharmacy online. People expect everything which is considering the new technology. So don't be left out. Join the technology bandwagon and support your patients. Customization of eye care for your patients. It starts, that we can't treat patients like in the assembly line approach where you give the same to every patient. Every patient is unique. They have their own needs, and we need to take care of them. So if you have, I can give you an example of reminders. If a 70-year-old cataract patient gets a reminder that there's a LASIK screening happening at 50% discount, that's unfair. You need to target your patients as per their needs and give them those kind of reminders. Even the treatment has to be customized. When you look at patients who, because of their age, because of their financial condition, everything has to be that you offer them what they can afford. Language. Now we are, India is not a country, it's a continent. The culture changes every 100 kilometers and language changes every 500. So what happens is that patients will come. You need to have, sometimes translators, multilingual people manning your call centers. All that needs to be done so that they feel comfortable and not alienated. When it comes to the regional sensitivity, again, people from various regions and religions have their own sensitivities, which we need to address, we need to keep in mind, and we need to handle them with the care and sensitivity that they are looking at and looking for. I'll give you an example. Like, a few years ago, we were treating patients from Libya, and so what we did is we arranged Arabic food for them, and they were like absolutely bowled over because they never expected that kind of sensitivity from our side for their food habits. So these small things go a long way in generating higher loyalty of patients. Gender sensitivity, again, very, very important. Especially the female gender, the patients may come, nursing mothers may come. You may need to provide them areas where they can breastfeed their children. Also, how these patients are being handled by the male staff, to maintain that decorum, the body language, the communication styles. We need to understand that they need to be given that special attention. When it comes to vulnerable care, please understand one thing is that, you don't want a 85-year-old patient walking in with the attendant on needing a wheelchair and you don't have it. So the wheelchair, and they need handicap toilets. These are all now becoming norms, especially because of the pressure from accreditation authorities like JCI and NABH. So please take care of such patients. And in eye care, it's very important because most of our patients who are needing cataract surgeries are all old, and some of them may need that special attention, and your hospital should be able to provide for that. Last, we come to the financial status. Sometimes patients may want to avail treatment, but they may find it that it's difficult because of the cost. Then provide them help. It could be, a credit scheme through EMIs, or engage with credit providers which can reduce the burden where their payment can be split over a few months, and that will definitely make them convert and choose your hospital for the treatment. Nowadays, quality is something which every patient is looking for. Many of the hospitals are now NABH accredited, and that increases the trust of the patient that they are coming where quality of care is of not just national but of international standards, and they will choose you more than probably the neighboring doctor who doesn't have these accreditations. So what I always believe is that the more you sweat in peace, the less you bleed in war. So please ensure that your staff undergoes trainings and retrainings and reinforcements so that they know your processes and protocols and handle patients accordingly. Also, we need to see that nowadays in the COVID time, especially, a lot of the trainings have moved online. It's a wonderful medium, especially for multi-centric organizations who can have people join in without having to travel, and it can be at their convenience. So please use these online platforms to impart training for your staff and doctors. There is a culture which sometimes we don't want to, report errors. We find shame in that. Please don't do that. Once you report the errors, what will happen is then you will have the culture of wanting to find out the root cause analysis and then doing a corrective and preventive action so that it doesn't happen again. So that is a culture that you should build in your hospital. Also, both for inpatients and outpatients, you need to work on reducing the process time so that even a minute saved is going to help the patient to feel better, that they went out in a better time than what they probably even expected. Net Promoter Score is the way that we measure patient satisfaction. And in healthcare, the benchmark is 71. And we all need to ensure that the percentage of patients who are our promoters is much, much higher than the passives and the detractors. Do regular audits. And whatever findings comes in the audits, please ensure that corrective measures are taken, and those actions can be reinforced over the period of time. Accreditation with NABH and JCI makes it mandatory, and even without NABH, please develop a culture of doing clinical audits. We should also keep our eyes on the equipment and resource utilization. And only when you have reached peak utilization should there be a need for adding a manpower or adding an equipment. Support. Now, this is extremely important, and patients, especially the elderly patients who come sometimes, need your help in processing insurance claims or getting reimbursements at times where they may be not able to run back and forth with the TPAs and insurance companies, so you may help liaison with them. They also need, explanation how to use medication. They should get refill reminders and help them with home delivery if you can. When it comes to navigation, sometimes our hospitals are not having the proper signages and guidances. Now people are working on apps where using GPS, you can even guide them through smartphones where they are in the hospital and where they need to go. I still remember AIMS from ages has those strips in which, you follow those strips on the wall and you can reach a particular department. And way back, many years back, CMC Vellore had touchscreen kiosks in their main lobby through which they help patients navigate the hospital. So if they could do that so many years ago, we should take care in our premises. When it comes to finance options, people are looking for 0% EMIs and tie-ups with credit providers so that reduces their burden. This technical support is something very interesting. People are now using a lot of technology, especially when you send somebody for home eye care. They want to know how to use the various things for getting their investigations or their eye checkup done. They need to adjust to, say, progressives when they are buying. So the optometrists and the opticals sales staff should help them with that adjustment. Help them for giving. Taking online appointments or giving you reviews, whether on Google or Facebook. So just telling them to get it done may not be the right approach. Helping them would be something that will go a long way in giving the patient the comfort and confidence that they seek for. Empathy, can't talk much about this, but by saying that empathy and compassion is something which we're not taught in, our medical school times, but is something I feel that should be part of our curriculum, and how we treat the patients by getting into their shoes and understanding what they are feeling will help the patients not just feel better, but their recovery is quicker, and they will remember that experience. So each and every doctor and staff should be empathetic. Communication, poor or no communication is the pain of 90% of dissatisfied patients. So that is the problem, that we are unable to properly communicate with our patients. And it begins right from the first instance that you interact with the patient. You will give your greeting. It could be like in our case, we say namaste and we tell our name and designation. Have a welcome smile. The smile for every patient, not just the first, but every patient. The last patient also, you may be tired, but still be welcoming and smile. Ask them, continuously what you should do is that what they need, ask their needs and also review it so that that whatever is happening and, when they need it next time, please go across to them. Especially if a patient is in a waiting area, and sitting and anxiously not knowing, go and sit down. Ask them how much time they have spent. Tell them about how much more time will be needed. Because what happens when they have nothing to do, they get all anxious and agitated. Please take care of that. And also, when they are leaving, say thank you. Because, they've given you their opportunity and a chance to, service them, to give them that experience. Be grateful and be thankful, so that the last thing that they remember of you is that thanks to that wonderful smile. Everyone looks at healthcare nowadays with suspicious eyes because, patients are grabbing more collars than feet. They're not touching feet more as much. They are grabbing our collars, because you must have seen social media, the TV channels is all full of news about how hospitals have, overcharged a patient, and, sometimes even the hospital premises have been ransacked by family members who just lost a loved one and they blamed the hospital. The nobility of the profession has reduced. And it's our responsibility together to win that back. Doctor used to be God. It's no longer the case, but it can happen again. But for that, the integrity, the transparency to patients is extremely important. And transparency involves with everything. You tell them about the treatment. They should know what is the treatment is happening and what will be the outcome. Don't overcome it. Especially when you have a guarded visual prognosis, tell them that there may be an outcome impacted by some pre-existing disease, so that when they finally get the outcome, they are not disappointed because nobody told them. So don't promise them everything which you even can't provide. Estimate form is such a key element when you are, counseling them for surgeries. So that estimate form is something which should translate into what the final bill was. There shouldn't be a huge disparity between the two. So that transparency in billing is extremely important. Duration. Now that duration could be for outpatient, it could be for inpatient, and you need to ensure that that duration is respected, and people are getting what they were told. So if you look at a few take-home messages, right now we are not marketing, we're not going out, we're not doing camps. The only way that we are relying on our patients to come back is by making our patients as brand ambassadors, making them so delighted that they will send 10 more patients back. So we need to do all confidence building measures, which could be, making a video of how safe your premises and all the protocols are, and share it with your patients so that they know that they can come to the hospital and they can feel safe. And whatever measures that you have implemented on paper, they should be on ground. People should, be wearing masks, and people should be checking them at the screening counter, and everybody should be in the prescribed PPE, and make an extra effort, because it's going to be that one chain or hospital which will make that extra effort to reach out to patients using mostly the digital medium, through WhatsApps, SMSs, emails, social media. Reach out to them, tell them that you are there, you're open, you're available, and also that you are taking all the precautions. And that has to be the proof of the pudding. Is when they come to the hospital, they should be able to see that that's happening, so that they can go and tell that whatever they promised, they are delivering on that. And nowadays, with so many change in protocols, that extra focus on training is extremely important. That please train your staff and doctors, and keep on reinforcing that training so that they are able to deliver and go beyond the expectations of our patients. So we should move away from trying to give explanations, but give them that delightful experience which they will remember for the rest of their lives, and talk about it to their families, friends, and relatives, and hopefully that will translate into many more patients coming to you. Thank you for the opportunity for listening to me. I will be open to your questions. You can reach out to me at the contact details shared, and would love to hear what have you done in the COVID times, and how you have worked on the patient experience, and what are the innovations that you have done, which can not just help you, but will be able to spread the word and help everybody else too. Thank you for listening.